Doctors and pediatricians are warning against a potential triple-demic. They're seeing a surge of cases of COVID-19, flu, and now RSV, especially among children. Our Elizabeth Holmes spoke with an infectious disease expert and a pediatrician about the recent trends. And Elizabeth, what are they telling you?
Well, these viruses are all respiratory viruses that are very similar in terms of severe symptoms, and there's really no way to tell what you may have unless you get evaluated by a doctor. Now, the doctors I spoke with say you can get infected with more than one of them at a time.
So we're definitely seeing more, and it's absolutely positively an important concern, the rise in viral infections this winter right now.
COVID-19, influenza, and RSV. Dr. Gonzalo Bierman saying the severe symptoms are similar.
Particularly in adults, there's no way to really distinguish between COVID versus flu versus RSV infections just by the clinical appearance. So if you have signs and symptoms of a cold or even a severe cold with shortness of breath and cough, etc., you need to go see a qualified medical professional to get the appropriate testing done.
RSV now impacting young children more than any other age group, now spreading among teens and even adults. Dr. Eric Freeman with Old Dominion Pediatric saying a third of their RSV patients in the past 2 months have wound up in the hospital.
One thing that has been very shocking for me as a pediatrician, the majority of children that I see with RSV usually are very young children, but I can tell you RSV right now is not discriminating against age. I am seeing elementary and middle school children getting hit just as hard with RSV as my young babies and infants.
And one virus can coincide with another.
That many children are getting co-infections. It's not just one virus, it's more than one. So it is not uncommon to see a child with RSV and influenza or RSV and another winter respiratory viruses.
Both doctors now encouraging COVID-19 and flu vaccinations and seeing a doctor as soon as possible to prevent an RSV case from becoming severe. That also could take the strain off of healthcare workers.
Not only in primary care practices, but emergency departments and many of the local pediatric hospitals have been completely overwhelmed by the amount of illness that is currently circulating.
Dr. Freeman said children get sick, especially because they're in congregate settings. He's encouraging masking and hand washing, particularly to prevent RSV from spreading from child to child.